Olmesartan-Hydrochlorothiazide is a medication used to treat high blood pressure. It helps prevent strokes, heart attacks, and kidney problems by lowering high blood pressure. This product contains two medications, olmesartan and hydrochlorothiazide. Olmesartan relaxes blood vessels, making it easier for blood to flow. Hydrochlorothiazide is a diuretic that helps your body get rid of extra salt and water by causing you to make more urine. It is recommended to take this medication as prescribed by your healthcare provider for the best results. The usual dosage is once a day, and it can be taken with or without food. It is best to take this medication at the same time each day to help you remember. Be sure to follow your healthcare provider's instructions for the best outcome. When taking olmesartan-hydrochlorothiazide, it's important to follow your doctor's instructions. Usually, you'll take it once daily, either with or without food. If it makes you urinate more often, it's best to take it at least 4 hours before bedtime to avoid getting up during the night to go to the bathroom. If you also take certain drugs to lower your cholesterol, like cholestyramine or cholestyramine, take this medication at least 4 hours before or 4 to 6 hours after those medications. The dosage of olmesartan-hydrochlorothiazide will depend on your medical condition and how you respond to the treatment. It's important to use this medication regularly to get the most benefit from it. Try to take it at the same time each day to help you remember. Even if you start feeling better, keep taking it as directed. Many people with high blood pressure don't feel sick, so it's important to keep taking the medication. If you don't see an improvement in your condition or if it gets worse, be sure to let your doctor know. This is especially important if your blood pressure readings increase. As with any medication, there are some potential side effects to be aware of when taking olmesartan-hydrochlorothiazide. Some people may experience dizziness or lightheadedness as their body adjusts to the medication. To reduce the risk of these side effects, it's important to get up slowly when rising from a sitting or lying position. It's important to remember that your doctor has prescribed this medication because they believe the benefits to you outweigh the potential risks. Most people who use this medication do not experience serious side effects, but it's important to be aware of the signs of dehydration and electrolyte imbalance, such as extreme thirst, dry mouth, muscle cramps, weakness, and irregular heartbeat. If you experience any of these symptoms, it's important to contact your doctor right away. Additionally, if you experience diarrhea, fainting, changes in vision, eye pain, muscle weakness, or signs of kidney problems, it's important to seek medical attention. Although rare, it's also important to be aware of the signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other symptoms that concern you, it's important to contact your doctor or pharmacist for guidance. If you are in the US, you can report any side effects to the FDA, and in Canada, you can report them to Health Canada. Remember to always consult your healthcare provider for personalized medical advice. This medication can cause harm to an unborn baby if used during pregnancy, so it's important to prevent pregnancy while taking it. You should consult your doctor for more details and to discuss the use of reliable forms of birth control while taking this medication. If you are planning pregnancy, become pregnant, or think you may be pregnant, contact your doctor right away. Before taking olmesartan-hydrochlorothiazide, make sure to talk to your doctor or pharmacist if you have any allergies or if you have a medical history of gout, kidney disease, liver disease, lupus, dehydration, high potassium levels, or skin cancer. This medication may cause dizziness, especially when combined with alcohol or marijuana. Be cautious when driving or operating machinery, and limit your alcohol intake. Also, report any severe sweating, diarrhea, or vomiting to your doctor to prevent lightheadedness or dehydration. If you have diabetes, monitor your blood sugar regularly as directed by your doctor, as this medication may affect your blood sugar levels. It may also make you more sensitive to the sun, so be sure to use sunscreen and wear protective clothing when outdoors. Be cautious with potassium supplements or salt substitutes containing potassium, and inform your doctor about all the products you use before having surgery. If you are an older adult, you may be more sensitive to the side effects of this medication, especially dizziness and changes in urine output. Pregnant women should not use this product, as it may harm an unborn baby. If you are pregnant or planning to become pregnant, talk to your doctor about the risks and benefits of using this medication. Additionally, consult your doctor before breastfeeding while using Olmesartan-Hydrochlorothiazide. When taking Olmesartan-Hydrochlorothiazide, it's important to be aware of any potential interactions with other medications you may be taking. Some medications, such as aliskiren, dofetilide, and lithium, may interact with Olmesartan-Hydrochlorothiazide and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist, and to not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, some products may contain ingredients that could raise your blood pressure or worsen your heart failure. It's important to inform your pharmacist of all the products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. Furthermore, Olmesartan-Hydrochlorothiazide may interfere with certain lab tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this medication. In terms of daily dosage and optimal timing, it's important to follow your doctor's instructions. This medication is usually taken by mouth with or without food as directed by your doctor. It is important to take it at the same time each day. If you are taking this medication for high blood pressure, the best time to take it is usually in the morning. If you are taking this medication for fluid retention, the best time to take it is in the morning so that you are not getting up during the night to urinate. If someone has taken too much Olmesartan-Hydrochlorothiazide and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include severe dizziness and fainting. Now let's talk about the uses of Olmesartan-Hydrochlorothiazide. This medication is used to treat high blood pressure. It contains two different medications that work together to help lower your blood pressure. It is important to take this medication regularly as prescribed by your doctor in order to get the most benefit from it. Your doctor may also recommend a specific dosage and the best time to take this medication. Always follow your doctor's instructions for the best results. It's important not to share this medication with others. In addition to taking this medication, making lifestyle changes such as participating in stress reduction programs, exercising, and making dietary changes may increase the effectiveness of the medicine. It's important to talk to your doctor or pharmacist about lifestyle changes that might benefit you. While taking this medication, it's important to have lab and/or medical tests done, such as kidney function, potassium levels, and skin exams. It's important to keep all medical and lab appointments and consult your doctor for more details. It's also important to check your blood pressure regularly while taking this medication. It's important to learn how to monitor your own blood pressure and share the results with your doctor. If you forget to take a dose of Olmesartan-Hydrochlorothiazide, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to stick to the recommended dosage schedule to ensure the medication works effectively. When it comes to storing Olmesartan-Hydrochlorothiazide, make sure to keep it at room temperature away from light and moisture. It is important to avoid storing it in the bathroom and to keep it out of reach of children and pets. Additionally, it is crucial to not flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, it is important to properly discard it. Your pharmacist or local waste disposal company can provide guidance on the appropriate way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.